And then if robotic surgery is there in prostate, why not in gallbladder? Or other way around, when there is a laparoscopic surgery for gallbladder, why laparoscopic surgery is not there for prostate?
Okay.
Is this the limitation of the space?
Yeah, I think we have to understand that human beings have got a limitation of a wrist movement. So when you move your wrist, you cannot move more than 90 degree in one side, whereas the robotic wrist can be moved up to 180 degree. So in a closed space,
so wherever wrist movements
are
required,
a
restricting factor, there robotic surgery will come.
And the commonest example of that is the pelvis, that is in the the prostatic area, where the bone, because of the presence of bone, the space is very, very limited. Whereas in abdomen, you can distend the abdomen and it is distendable.
In terms of pain, in terms of hospital stay, minimal invasive and robotic are same.
Both will be the same, because minimally invasive surgery and robotic surgery are the same, except the hand movements done by a human being with a limited wrist movements of 90 degree versus the wrist of a robot, which is controlled by the human being, where the wrist movements can be extended to 180 degree.
Sir, there is
in conventional surgery, the duration is, hospital stay is how many days? Conventional surgery?
Almost 3 to 4 days.
3 to 4 days.
Yeah.
And
and now it has become a daycare. Gradually, it's
daycare means 24 hours.
24 hours.
Yeah. What about the pain?
Pain is quite less. Pain is very, very less with the minimal invasive
healing.
Surgery. Healing is very fast.
Office time.
Patient can immediately after 1 or 2 days he can join his job. Very fast. He can start work. Even in hernia, which was supposed to restrict him for 3 weeks initially.
What about the cost?
Cost is initially little higher, but overall cost is almost same or less, I think.
So in a hospital setting, the cost will increase by what percentage?
In the hospital setting, if you take a cost day by day, it will sound little more. But if you look at 5 or 6 days or 7 days stay by conventional surgery versus 1 day stay, it is economically very viable, and especially in a country like India, where we have got a lot of manual workers who have to go back to the work to earn their livings. They can go back to 100% of their activities within couple of days after the operation.
Why do we have so many gallbladder stones in India?
Well, I think it's early diagnosis. I think it's a lifestyle. When you have enough to eat and less physical activity.
We used to call them as fatty,
yes,
female fertile.
Those situations are not.
And then why in North India? We have so much.
Well, I think North India is again because of affluence and our diet, which is rich diet, and that has led to increase. Of course, we cannot ignore the ultrasound facilities, which has increased the diagnosis dramatically, because the previous investigations like oral cholecystograms and intravenous cholangiograms were very exhaustive and very difficult investigations, which could sort of detect the gallbladder stones.
Even the lifestyle is very important, because the people are not following the normal routine lifestyle. They are taking lots of fatty meal, no physical activity, staying in a cold air conditioned room. So the movement, because I have seen people who are coming, there was lots of patient came with some report with fatty liver, and after few months or years they will have a gallstone. So there are
fatty liver is white sugar, white rice, and white maida. Couple of patients came to me and they said they had gallbladder sludge, and they said they were advised surgery, and then they drank a lot of olive oil, and they said it dissolved. Any such experience?
No, I think we must understand fundamentals and the pathology. If we see, the formation of gallbladder stone is a disease of the gallbladder wall in terms of over concentrating the bile. It is nothing to do with sludge or stone. Sludge is the initial part of the stone, and when you drink olive oil, what your gallbladder vigorously contracts and pushes out that sludge which has been formed, and in a near future you will see that there is no sludge or this thing, because you have flushed it out. But we have to consider that just the sludge disappearing does not take away the disease which is situated in the wall of the gallbladder.
But that cases are,
they are 100% gallbladder stones.
Why I am saying is because many people who are quacks, and they come back and say that I have removed it, and they say I can do a surgery without a knife, and they actually are the natural spontaneous dissolution of
no,
olive
these
oil
are all
and green apples.
Being a very busy practice, and we see hundreds of cases every month, we have realized that many patients will come whose gallbladder has been shown as to have a sludge in the past, and they got some homeopathy or whatever, and it disappeared, as you rightly said. If you take olive oil, which is a very high fat content, and as we are aware that any fat content will vigorously contract the gallbladder, and the sludge will go out into the common bile duct and will pass off, because it's like a
What is the risk of cancer in a gallstone?
6.9% in Indian genes. We have to understand it varies from the Western genes.
The Western gene talks about 1 in 50,000.
Yeah. But Indian genes are prone for.
But before this cancer, one of very
do
important.
We have a registry in India which talks about that so many gallbladders were removed and the histopathology showed so much percentage?
Yeah, definitely.
We see it in everyday life. So the longer durations, more than 10 years of presence of a gallstones, have got 3 to 4% malignancy rates, which we see in our own practice. See, I operate about 350.
And if this malignancy is not operated, what will happen?
No, they generally.
No, gallbladder cancers are how serious or how bad they are?
They are very fatal.
They are fatal.
Because of their proximity with liver.
That is the advantage of minimal invasive surgery, that we detect it very fast. If something can be done, either we can plan for major surgery, we just go for the
child comes to you with acute appendix, and he is getting pain, his counts are high, and he needs immediate surgery. So, I am talking about in acute appendicitis, is there any complication?
Laparoscopic surgery.
Yes, I am talking about minimal invasive.
It's depending on the age. Now, I have last up to age of 4, I have operated with laparoscopy, and it has been wonderfully done, because in acute attack.
So, in India, people can operate starting from age 4 to any age?
Yes, definitely.
What about less than 4 years of age?
No, that in a specialized center where we have got pediatric instruments, those
it can be done.
Yes,
so, it is possible to do it at any age?
At any age, in a neonatal age as well.
At any age. For the knowledge of my viewers, just to define, when do they suspect it is acute appendicitis?
I think acute appendicitis is a clinical diagnosis. First, the pain starts in and around umbilicus, and then gradually settles down in the right lower abdomen. And the commonest cause definitely is appendicitis. In fertile females, it could be because of the rupture of the lutein cyst, and that also gives us a great advantage of laparoscopy, where you in a females, when you go in and see that the appendix looks normal, but there is some blood seen in the pouch, which is the ruptured sort of ovulation cyst of the ovary, which nothing needs to be done. So, in females especially, it helps in a big way to diagnose whether the lady is suffering from appendicitis or some gynecological
Let's come back. Benefits and advantages of laparoscopic surgery. That means I want to tell my viewers very clearly that laparoscopic surgery is the answer for today, and therefore they should not be afraid. They should go and ask their doctor that I want a minimal invasive surgery.
Correct.
A, duration. So, you said 24 to 48 hours?
48, yes, that's a
48 hours patient can be discharged?
Absolutely.
2, any age?
No age is barred. Anybody who is fit for anesthesia is fit for laparoscopic surgery.
3, duration of anesthesia is small?
Definitely, because you save on the incision side. Yeah.
But it is the duration of anesthesia is smaller.
Yes.
Pain
is far less.
Far less.
Very early.
They don't require pain killers for.
Very few require painkillers.
Early rehabilitation?
Absolutely.
That means they can go back to office at what time?
I think if they are fit enough, they can go in 2 days time.
But
most of them, they will go back in 5 to 7 days.
Number of stitches?
There's hardly any stitches.
Nowadays we are hardly giving stitches. We just put an adhesive glue. And
so practically no stitches.
Yeah, just pull out a dressing.
Scars?
Scars are invisible almost.
I'm talking about a young
Yes.
dancer who wants to show her abdomen.
Absolutely.
4 punctures.
Instead of 4 punctures, it's a 18 size needle, which is 2 millimeter.
Yeah.
So 2 millimeter punctures are hardly visible. Mosquito bite produces much bigger scar, or a pimple on a face produces a bigger scar as compared to
single pole, single port.
We go through umbilicus, so the scar is not visible at all.
Practically, and single port surgery now can be done for everything.
Mostly, yes.
Even gynae.
Yes, definitely.
And then why people are not doing it and asking for it today?
It needs more surgical skill and special single port equipment.
Equipments and everything.
Cost wise is not very.
Cost wise is little more expensive. About 20% more expensive.
20% more, so which I think is reasonable.
Yeah.
Available everywhere in the country.
Single port is not available.
No. Minimal invasive surgery.
Minimal invasive is now.
Do you require special training after doing MS surgery?
Definitely.
Or it is being taught in MS surgery?
They have started teaching in MS surgery also, but there are some limitation, because for especially if you are focused for minimal invasive, you must go and attend special classes and training program.
Simulators are available, training is available, expert teachers are available. Any other advantage of minimal invasive?
Well, I think that makes all. I think the hernias after the minimally invasive surgery, the wound infection and wound hernias are practically zero. So there are no herniation. With a large scar, there is again a.
What about the recurrence? The recurrence will be less. Incisional hernia will be less.
Definitely.
Sir, there is one advantage of hernia, that even those patients who was operated open by open method and have a recurrence, this is one of the biggest good choice. You can go TEP directly without. I mean, the minimal invasive department is
my last question. You said that in pregnancy we cannot do anything. But in pregnancy,
in cesarean.
In cesarean, no, yes, cesarean you cannot do in pregnancy. But in pregnancy, can you do some fetal surgeries with laparoscopic?
Now it is coming up, the intrauterine surgery, what is known as IUS, which is, so you put in a endoscope into the, by making very tiny punctures in the this thing.
Quickly,
and you can
correct. What are the surgeries we can do in thoracic cavity?
In
thoracic cavity. Video assisted thoracic.
Video assisted.
Yeah, we can start from pleura. It's very important.
So most of the surgeries can be done. Can you do cardiac bypass surgery?
Single vessel.
Yes. Can you do transplant? Which transplant we can do?
Kidney transplant.
So kidney transplant is now possible to
by
do it by minimal invasive surgery. So that's what we have learned today. And what we have learned today is that most of the people are not aware that minimal invasive surgery is available in the country. Everywhere it is available. We should ask for it. It is safe. It is quick. It is less pain, less dose of anesthesia, less requirement of antibiotics, early discharge, maybe 10-20% costlier, but that doesn't make any sense. It is possible from head to toe, every surgery. Where your hand cannot reach, you have robotic surgeries. Obviously, robotic surgeries today may be slightly more costlier, but the time is going to tell when robotic surgery is going to be within the reach of a common man. When it comes to prostate, robotic prostatectomy is the answer if you want to avoid any side effects. That's all for today. We'll be back with another subject. Take care. Holistic.